Welcome back to the Best of Health. You know, most people have something about their body they'd like to change, or at some point in our lives we may require plastic surgery. But what do we really know about plastic surgery? Our next expert is board-certified full-body plastic surgeon, Dr. Mauricio Castellon. Dr. Castellon, welcome to Best of Health.
Well, thank you. Thank you for having me.
Now, I want to ask you, when someone's considering plastic surgery, what are the most important aspects they should consider?
Well, you know, we now live in an information age. It's important to investigate what type of plastic surgery you're interested in pursuing. In addition to that, you want to make sure that you go to a credentialed provider, somebody who's well trained in plastic surgery. Typically, you want to look at somebody who has board certification by the American Board of Plastic Surgery. What this means is that this is an individual who completed at least 4 years of general surgery training, as well as 2 years of plastic surgery training. And what that does, it gives the surgeon the ability to do anything from head to toe. So by investigating a little bit, you'll get to the right hands.
Okay, so in addition to certification, what else should a person look for in a plastic surgeon?
You also want to make sure that this person has some history in where you are. You want to make sure that this person has credentials not only by the American Board of Plastic Surgery, but also in the community. I am the chairman of plastic surgery at Holmes Regional Medical Center. I have been for 6 years. I also have admitting privileges at Wusthof in Melbourne and other small facilities, surgery centers, if you will, here in town.
Okay, and what else? How many years have you been in the area? And
I've been in practice for 9 years, going on 10. And we're in our current office in Melbourne for approximately 6 years now.
Okay, very good. Now, earlier at the beginning of the program, I mentioned that there's elective surgery, plastic surgery, and then what we typically think of, you know, when we talk about plastic surgery, and then there's times when someone might require plastic surgery. For you, what is the most common type of plastic surgery?
Well, there's two hats that I wear for plastic surgery, whether it's the reconstructive hat or it's the cosmetic hat. When we're talking reconstruction, the most common procedures that we do in the office are either skin cancer excisions after a dermatologist has seen a patient, or breast reconstruction following a mastectomy. Let's say a general surgeon unfortunately has seen a lady who has been diagnosed with breast cancer, and it is our responsibility to reconstruct a breast and give her some sense of femininity after, you know, she's gone through a horrible disease. When I'm wearing the cosmetic hat, I'm primarily concerned about creating a very natural appearance. I'm a big fan of after surgery, patients leaving my office with a sense of a natural beauty. If they go out to the community and let's say they run into their friends or acquaintances or families and they look better but nobody really knows just why, then I've accomplished my job and I'm very happy with that.
Now, what are some of those types of procedures? Kind of just name some of them.
Well, the most common procedures that we do when we're talking cosmetic plastic surgery is facial rejuvenation, such as eyelid lifts, face lifts, brow lifts, neck lifts. When we talk about breast surgery, we discuss breast augmentation, breast lifts, breast reduction surgery. When it comes to abdominal surgery or body contouring, which includes not only tummy tucks but also liposuctioning, what we're doing is we're discussing improvement of the abdomen, the torso, after, let's say, somebody's lost a good amount of weight after massive weight loss, or somebody who, after multiple pregnancies, let's say, wants to get their figure back to where they were. Now, when it comes to the most common procedure that we do in this country, it's liposuctioning. And liposuctioning is done anywhere from head to toe, but it's a great procedure to improve those areas that really do not respond to diet and exercise. These procedures, typically these larger procedures, are done under general anesthesia if it's a large area, but they can be done under local anesthesia if it's a smaller area that we need to treat.
Okay, and you also do non-invasive types of procedures as well, correct?
That is correct. We also are a big proponent of non-surgical rejuvenation, such as Botox, or fillers such as Juvederm or Restylane. I think these work well. They serve as a bridge between procedures, let's say. And the great thing about them is that patients can come in, have their non-surgical procedure during their lunch break, if you will, and then go back to their daily life.
Wonderful. Now, if they want to know about the pricing or how this is going to cost them. How do you handle that in your office?
Well, the best thing to do is to come in for a consultation. You know, you come in, you meet with me. You typically come in, watch a movie. You basically sit down and with my nursing staff, and we do a history. We want to make sure that you're going to be safe to undergo the procedure. In addition to that, you will meet with me, and we will discuss what you're interested in doing. Once we sit down and discuss what you're interested in, we then sit down and talk a little bit about pricing. And pricing is variable, depends whether it's non-surgical versus surgical. And for those patients who are interested in, let's say, financing, there is some plans that work with us with interest-free financing for those who qualify, and they work quite well.
Okay.
There are some people that come in for the reconstructive part of it, where their insurance covers a good amount of it. What we typically do for those patients is we go with what's called a pre-authorization process, and we speak to their insurance providers to see if this is a covered benefit.
Okay, and if our viewers wanted to be able to reach you, how would they go about doing that?
The easiest way is to call the office. Our office number is area code 321-729-9909, or to go on the web. Our website is www.drcastellon.com, and it's D-R-C-A-S-T-E-L-L-O-N.
Okay, well, it sounds like you're keeping very busy. Are there any things that you like to do on your off time?
Well, we do like to give back to the community. We're very involved with several organizations to give back to those who provide so much for us here in Brevard. In addition to that, I recently got back from a mission trip in Nicaragua. I thought that was very rewarding. I have roots in Nicaragua. We did a week of helping kids out with cleft lip and palates, and I thought that was very rewarding and very appreciative. We'll go back next year.
Wonderful. Well, are you considering plastic surgery? Choose your plastic surgeon carefully. Find a surgeon that is board certified, a compassionate plastic surgeon that will address each patient as an individual. And if you have any questions, again, contact Dr. Castellon. And Dr. Castellon, any final comment?
Well, the last thing I want to say is that we do have a spa in our office, and it provides what we call perioperative care after procedures and before procedures to make sure that we kind of close the loop, close the circle, if you will, for your care. Again, please contact our office if you have any questions.
Great. Well, Dr. Mauricio Castellon, thank you so much for being with us on Best of Health TV. And we'll be right back with more of Best of Health in just a moment.
For more information on health issues, pick up a copy of National Health Review magazine. National Health Review is Central Florida's premier source for dedicated health, wellness, and medical information. An award-winning publication, National Health Review magazine is published locally and focuses on what you can do right now to improve your well-being with easy-to-read and entertaining stories, resources, and local services to help you live longer and healthier. To learn how to pick up your free copy of National Health Review or to sign up online for health briefs, go to www.nationalhealthreview.net.